So guys, I'm itchy.
No, where are you itching?
On my head, behind my ears. No, not lice itchy.
No.
Are you sure it's not lice?
No, it's not lice. That's not lice.
Have you checked?
Yes. And of course, I'm never not going to check ever again after what happened to my household.
Okay.
No.
What type of itch is this? Can you describe the itch?
I've been having a lot of skin things. My psoriasis since the wildfires has actually been more irritated. And I've noticed that I've had more skin things in general. And so have my friends. You know, we've just noticed with the air. And I don't know if it's the pollution from the fires or if it is just like the Santa Ana winds, you know, that came in because that blows up a bunch of stuff, obviously, too. And I'm really excited to talk to Dr. Ghasri again today, you know, our favorite dermatologist.
Yes,
our total fave,
who owns Castle Dermatology with his brother. He is going to come chat with us again today, which I'm super excited about. And I have to say, before we talk about my itch, his story about the bullet in the back, like, literally blew the internet up.
Right.
Now, I want to clarify for our, listeners and for anybody who asked the question, which we answered on social media, the man is okay when he took the bullet out.
Oh, that's wonderful.
Can you imagine having a bullet lodged in you that long and not knowing, right, that that's what it was? But Dr. Ghasri said that he had a lot of relief.
Right.
That's why I love him. He's got so many great stories, but we had to not put a nod to the bullet story because I called him and I was like, your bullet story, a little viral there.
Well, thank you for the update on that.
He's okay because people were wondering if he was okay. And yes, he is okay. But yeah, so we're super excited to talk about Dr. Ghasri today. Just in general, it got me thinking, and I know I texted both of you too.
Yes.
Living in an urban setting like Los Angeles or Atlanta, there are so many other things that affect our skin, right? Because we're up against pollution and obviously the wildfires right here in Los Angeles, which are causing more skin issues and also air quality issues. But across the board, I mean, we're seeing some wacky weather and things happening with natural disasters. So we can get into like how hurricanes affect your skin as well as you guys are experiencing snowstorms and blizzards in the South, which is not a common thing, right?
Right.
Well,
and I'm sure it affects the way that your skin is going to react to the humidity, or if it's really dry and then suddenly it's really cold and suddenly it's really hot and you've got the heat on in the house. So I'm sure that's got to affect our skin in some form.
Yeah,
well, not only just, the weather, but just how about everyday commuting? And so how is the pollution? How does the sun exposure? How does that affect our skin as well?
Yeah, the sun exposure, right? It's funny because Delaney has experienced some skin things after the wildfires too, irritations and things like that on her skin. But children's skincare, child skincare has become a thing.
From the talk.
Yeah. And even as you know, like I don't allow my daughter on TikTok, but it doesn't matter. All the friends have probably seen the talk and having a routine, which they're very proud of. But I'm always worried and curious about talking to Dr. Ghasri just about children and their skin.
Right.
What we should do and not do, especially this time of year, right? We're in the winter months and this is when across the board, no matter where you live, like you said, I think, isn't Atlanta like warm today and it was snowing 2 days ago?
Yes.
But with kids too, you don't want to put something on them that's toxic and harmful or that's going to negatively affect, the health of their skin. So what's safe to put on a kid, for skincare? If there even is such a thing.
And then we'll dive into all that with him today.
Oh, gross. The drama's about to end, 'cause gross. Stop asking for a friend, taboos. Ick is what we do, it's just science. Yeah, it's not so weird. Your gross out journey starts right here on Oh, Gross.
Let's welcome our Dr. Ghasri.
Yay!
Our favorite.
Yes.
Well, good morning, Dr. Ghasri. We're so excited to have you here again.
Good morning. Good morning. Thanks for having me.
Good morning.
Good morning. Welcome back.
I'm happy to be here. Thank you. Thanks.
We can't wait to dig into the skin.
Let's do it. Start our morning right.
So I know we have said this before, but I'm going to say it again. Here at Oh Gross, we don't just talk about the gross things. We like to, explore quote unquote gross.
Right.
We are trying to normalize these conversations.
Yes.
And there are some dermatological conditions that people are grossed out at, and they should not be. Is there any gross, sort of misconception about dermatology that people assume things that they're wrong about?
Some patients think we're just skin beauty experts, but we're more than that. So, I like to get into the gross cysts and the bleeding lesions. So
your life is gross.
Yeah, I guess I take it for granted because when I'm seeing blood and guts and things bleeding out of their skin, I don't mind it. But then I'll look at, like, let's say a new assistant is starting and she looks like she's about to faint, or like the family member is about to pass out. So
and that's the whole point of this podcast is we don't want people to think gross is gross anymore, and that you have to talk about these things.
Gross is not gross. Yeah.
Gross is not gross. Yeah.
Gross is not gross.
Yeah, because knowing that a mole can bleed, that saves lives, right?
Right.
Yeah, no, for sure. Actually, yesterday I had this really, really sweet patient who has metastatic breast cancer, and she has, a lot of hair loss, and actually the breast cancer had spread to the skin. It can actually present on the skin as these firm pink nodules. And she was so hesitant to take off her hat and show me, and she was apologizing profusely ahead of time. And I just had to, just let her know you're in a dermatology office and you're in a safe place, and don't be afraid to bear it all and show us whatever you need to. Yeah, she was very self-conscious. And again, because we see these 40, 50 patients a day with these lesions, so we take it for granted, but we have to realize that they go home and they're surrounded by people maybe with perfect skin, so they feel self-conscious about it. But no, at the office, just show it all, and yeah, we'll take care of them.
And I think that's a good point in general in health, right? I think a lot of people avoid doctors because they're embarrassed about XYZ.
Exactly. There's a lot of denial out there. Yeah.
There's a lot of denial out there, whether it be something going on with your butt, right? Or your skin or anything. And we really want to hit home and keep reminding people, don't be afraid to talk to your doctor.
100%. Yeah. It can save your life for sure. Show anything that you can that looks suspicious to you.
People forget that's their job. That's their expertise.
Yep.
That's what they're there for.
Yeah.
That's what they're there for. Absolutely.
It's normal to the doctor to be able to see that every day and help you.
Yeah. There's no judgment.
Exactly. You don't think it's gross. There's nothing that you do, Dan. You love your job. I know you love your job. That's why I love you. And right.
Yeah, there's nothing that will gross me out.
When I walk into your office, I can tell you love coming to work. You love your job every day.
Thank you.
So Dr. Ghasri, we're going to start with, because you and I are in Los Angeles and we live very close to each other, and I'm close to your office, and you are experiencing the same things I am in the air right now from the wildfires. What are we typically seeing? Because I know that for myself, like I definitely have had more flare-ups on my scalp with the psoriasis since the fires. And I know other friends have complained about different things and just feeling that, like, even inside their ears, right? Like that there's just kind of been more extreme skin conditions. So what are you seeing more of in your office after the wildfires, or even after the Santa Ana winds we had?
We're seeing a lot of exacerbation of skin diseases they already have. So a lot of flares over their atopic dermatitis, psoriasis, rosacea, acne. These are all skin conditions that are common in patients with sensitive skin. So, as soon as they get a chemical irritant, they can flare up. And on top of the dry weather, it can impair their skin barrier more. So they get flare-ups of these conditions.
There obviously are different toxins in the air after something like a wildfire. So can you explain a little bit about atopic dermatitis and what that is and how it's correlated to what's in the air?
Yeah, so atopic dermatitis, otherwise known as, it's a type of eczema. It's basically patients don't have the proper skin barrier to hydrate their skin. So their skin is more sensitive to certain chemical pollutants or just anything, or too much water can irritate their skin. So it creates inflammation, and then that leads to a red, itchy rash on certain areas.
So even water. So like if you lived in a hurricane area and you experienced like a ton of rain, could that also see the same thing that you're seeing after a wildfire?
Sure, yeah. Too much water in general can irritate the skin.
What is different after a wildfire with the pollutants that are in the air and how it can affect your skin?
Wildfire smoke is not supposed to contain so much toxic chemicals, but because you're combining the normal air now with burned rubber, metals from cars, household products, things that shouldn't be in the air. So that's definitely causing a lot of problems for not just the respiratory system, but for the skin too. My
daughter had all of a sudden like a red ring, right, around her eye. And then there were a couple of dots like on her eyelid that it seemed to be like completely irritated. So is that what that is? Like basically?
Possibly an airborne contact, yeah. Yes.
Because I did notice it, it eventually subsided, but it was like a couple of days when the winds were still kicking up and things like that, that we noticed it around her eyes. Yeah.
Yeah. And then, also this fires happening in the winter months where these conditions would usually flare up anyway. So it's kind of like a double whammy for these patients.
No, that totally makes sense. And is there anything that we can do? Like if you know you're somebody who's sensitive, like myself,
right?
Yeah.
I know not everybody experiences wildfires, but they do experience in the winter, especially in California, the Santa Ana winds. Other parts of the country have, different harsh conditions in the wintertime. Are there things we can do to sort of tame down, a flare up?
Yeah, I mean, the most important thing is to try to hydrate your skin as much as you can with moisturizers, lotions, Patients with atopic dermatitis know they have to lotion up their skin as much as they can. So they just have to be a little more vigilant with it and do it a little bit extra. And then maybe try to take shorter showers because hot water really dries out the skin too. So shorter, lukewarm showers. We rub some baby oil right after the shower. And then, try to avoid outside as much as you can when possible.
That makes my scientist mind kind of think about there's got to be so many different factors, like you were saying, the different chemicals that are in the air. And with the atopic dermatitis, do you see maybe some of it could even be allergies to some of the different chemicals that could be in the air that affect the skin?
Very much so, yeah. It's very possible, especially certain metals in the air,
Right.
Oh, yeah.
Oh.
These items usually shouldn't be in the air. After a wildfire, they unfortunately are. And then patients can undergo patch testing to see if they do react to any of these certain products.
Oh, so you can go in and get tested and see, like, is there a higher concern right now for you because you're allergic to XYZ?
Yeah, commonly, patch testing where they put strips of different chemicals on your back, either done by allergists or dermatologists, and see if you do form a contact allergen to that specific agent.
Because is the majority of stuff we're dealing with after a situation like this going to be actual contact with your skin?
Yeah, airborne contact or just irritating the skin because of their impaired skin barrier to begin with.
So if kids are out doing sports, should they maybe come in and take a shower? That makes me think about moms, right, Kara? About kids being out and busy after school. So do we shower them?
Yeah.
Honestly, with my kids, I'm more worried about their respiratory issues than their skin at this standpoint. They're out playing in the yard, and it's hard to keep N95 masks on kids. You can't. I mean, they're not going to.
I know, especially when they're playing at school or sports. I mean, I have the same problem. I mean, like, you try to do your best, but in the same sense, you don't want to take too much away from them, right? Like, because that's causes stress and more anxiety at this whole situation to say, oh, you can't play outside.
Exactly.
But in general, too, like, moving for a second away from the fires, Los Angeles has a lot of pollution, right?
For sure.
Is it different here? Do you see, like, skin conditions at a higher rate anyway because of our pollution?
Possibly, yes, because California goes from, super hot in the summer and a little bit humid to, very dry in the winter. So, in December, January, February, we do see an uptick in these conditions, psoriasis and eczema in general,
In general, because we have a high ozone pollution. But, I got to tell you, I'm going to throw this to Jenny. Jenny, can you please tell us all what ozone pollution means? Me and Ryan, our producer, were laughing. We're like, we know we have it, but we don't really know what we have.
Right. Well, talking about all of this in any city, but for you guys right now, especially to LA, you were already worried about smog. But with ozone, when you've got ground level toxins like from car exhaust and things like that, and it mixes with the sunlight, and that will create kind of a ground level pollution, which then will rise up in the air. And that's what our ozone pollution is. And there's so many different things. It could be, like I said, the chemicals from car exhaust, different nitrous oxides that are in the air. And so we get this horrible mix with the smog and all these pollutants that are up in the air. And that's what we're breathing. And then maybe Dr. Ghasri can talk about this too, but we've got dry conditions. And so it's not getting washed out of the air. So we've kind of got this layer of stuff floating.
We have the valley here too, right? Yeah,
right.
Because much like Colorado and other places too, when you kind of have it, I would imagine trapped a little bit by the mountains, it's more intense, than other places. But I did read, and I think it's really funny, and I have to ask Dr. Ghasri, that it can also age your skin.
Sure.
Is that why there's so much plastic surgery?
No.
Exactly. We're seeing an uptick of aged skin. No, that's I guess, chronic pollution. Sure, it can age your skin. Much like UV rays can. These chemicals are also toxic to the elastic and collagen fibers, so it can break them down, and that's what gives you that wrinkled appearance. But this isn't over like a 3-week wildfire. You still got it. You're good.
So you're basically saying that I don't look too old in the last 3 weeks?
You did not age in 3 weeks. Well,
here goes the Kara question. Here we go.
But I think this is important too. We are talking about these things. I think, Dr. Ghasri, what you said is really important. It just doesn't happen overnight. Right. This is extreme exposure to pollutants over and over again can age your skin, and it's something to be aware of. Yeah,
sunscreen, of course, to battle the UV rays from further aging. You can use a vitamin C serum that prevents oxidative stress.
We love a good vitamin C serum. I'm glid you like that too. Yeah. Because also, even in Atlanta, you guys have been having some extreme weather, right? I mean, Florida's having blizzards. This is all stuff that affects your skin too, that I would imagine if you live in a place where you're not used to having that type of weather, right? It's going to affect your skin as well.
Well, I mean, here in Atlanta, it's been kind of all over the place. We've had dry, we've had snow. Now we're at 70 degrees. So it's kind of all over the board at this point. So everybody's just naturally dry and itchy at this point.
Yeah. Because I am all about some collagen. We're trying to make a barrier to where we're not putting stress on the skin to where our collagen can break down easier. Is that what we're doing with the sunscreen and the moisturizing and all of that?
Exactly. And the vitamin C serum. Yeah, just
and the vitamin C serum.
Protect the collagen, protect the elastin, and you'll be good.
Okay.
You'll look like Kara. Yeah.
Yes!
Yeah, that's the goal. She's the benchmark.
I'll look like
you. You just made my morning.
I try.
See, you're gorgeous.
Yes, girl. Yes.
Look at all that collagen. Your collagen is one for the books.
I do have a question. So living here in Atlanta and of course in LA, the traffic is awful. It's terrible. I spend a lot of time in my car commuting every day. And I know that there can be some pollutants in the air. You can be exposed to some of those rays from the sun over time. So can you kind of talk to us about those things and what we can do while we're commuting?
Yeah. So, most windshields of car windows, they do a good job of blocking UVB rays,
okay,
but not so much UVA rays. And UVA has longer wavelengths, so that penetrates deeper into the skin. And that's actually what's responsible more for premature aging and breakdown of collagen and elastin versus UVB is more of the skin cancer risk.
Oh.
Yeah, so UVA does penetrate. And if you're commuting for a long time, maybe protect your hands, protect your forearms. That can help prevent the signs of aging. And, I have a lot of patients here who, were truck drivers or had long commutes. And you could noticeably see the difference from their the left side of their arm to the right arm.
I was just going to ask that.
I have a friend who's a tour guide, and he said his left arm is definitely aged differently than his right.
Yeah.
From having his arm up on the side.
Yep, for sure.
Mm-hmm. Just for me and anybody else who maybe doesn't understand, what is the difference again between A and B UV for the layperson?
It's all on a spectrum, but UVA is longer wavelengths of lights, and the longer the wavelength, the deeper it can penetrate into the skin.
Okay.
UVB is shorter wavelength, so that causes more of the DNA damage that can lead to skin cancer.
That leads to skin cancer. And we know how to protect against that.
Yeah.
Will sunscreen protect against UVA?
For sure.
Okay.
All sunscreens protect UVA, UVB. Yep.
Okay, great.
There are also pollutants that you may get pimples or black, breakouts, itchy skin. What are things that we can do for that as well? Yeah,
you want to wash your face right after, especially that's the same way kids get acne after exercise. You want to wash your face right away as soon as you come home. You can use a salicylic acid wash or salicylic acid pad to help unclog the pores, and that'll kind of free them up and prevent the occlusion that can cause acne.
Okay.
So if you know that you're outside, and high winds can be anywhere, right? And then anytime you're in a windy situation, Chicago windy, right? It's a good idea to kind of do that extra effort to sort of clean out your pores because you are getting things in them. We'll call it things.
Yeah.
Makes sense.
Pollutants.
Makes sense.
Yeah, clean out your pores and then hydrate with a light lotion, like a non-comedogenic, non-acne forming lotion, and you'll be ahead of the game.
I think that also makes me think about too, because Molly brought up such a good point about the car and commuting. Like, is there anything through the vents? Have you ever seen, or is anything because is that air coming from the outside in?
I'm not in terms of skin problems. Not that I've seen, honestly. That's an interesting question.
Well, because I just feel like I blow that stuff right on my face.
Yeah. I mean, maybe you should get your lungs checked, sure, but I don't know about
that's the next episode. We're going to do the whole lung thing in a different episode.
Yeah. I think you'll be okay.
So skin cancer. Can I ask about skin cancer? Because do we see higher risk of skin cancer when we have more pollution in the air? Does that
or more
increase
urban
our
settings,
risk?
Right? Yeah,
or in a more urban setting with higher pollutants.
That's a good question. Possibly squamous cell skin cancers, yes. I mean, in our practice, I'm not seeing like an uptick of it, but squamous cell cancers can be caused from poor wound healing or increased just skin damage or recurrent skin damage. Whereas basal cell carcinoma is the most common skin cancer. That is more from UVB light.
Okay.
And I think patients with prior industrial exposures, like let's say arsenic, that's a known trigger for squamous cell cancers.
Good information.
Mm-hmm.
Yeah.
Okay, let's shift the conversation a little because we haven't talked to you in a few weeks.
What's up?
And we are dying to know if you have another great story for us.
Oh, lately?
We missed you. We missed you, Dr.
I know,
Ghasri.
I'm trying to think of any.
That bullet story blew up the internet.
Oh, it did.
Yes.
It did.
You know, one patient told me about, she didn't do it herself, but she saw it was on, I think, TikTok or something like a few years ago. It was semen facial. Like not sperm semen, human semen facial.
Human semen?
Like her, I don't know if...
So she comes in. So I want you to walk me through. No, you're not getting away
This
with
is going to go in a whole different direction.
No, she saw it on TikTok.
You need to walk me through. She comes into your office. She sits down. And what does she say?
No, I mean, it just came in like a passing, like, like one of the craziest things that she saw. She asked me if that was legitimate. And I was like, I honestly have no idea. But and I looked it up later, but it was, some girl it was her friend's semen. He was putting it in containers for her, and she was rubbing it on her face. Yeah, and she was swearing by it.
For her to have a facial.
Excuse me, honey. I need my moisturizer now. Take this cup.
So, that one you guys should definitely look up. It's I think there's photos too. So.
I wish I could have been a fly on the wall when she was like, "Okay, I have a question, doctor. Is this true? Should I get some semen in a jar?" No.
But so there's a lot. There's especially with TikTok.
I'm crying.
It's almost a relief that TikTok was off for that 24 hours or whatnot. I got a little break.
I was gonna say, did it slow down a little bit
for a good 3 hours? Yeah,
got a little break.
Yeah, and also if people are seeing things on the internet right now, do you personally think that a lot of it is hype when it comes to all this kind of stuff?
The internet, there's always fear-mongering in the internet and media.
Right.
So, you just got to take a step back and just take a deep breath and know that it'll be okay.
And ask your doctor.
That's why we come to you with all the questions.
Right.
Yeah, and ask the doctor.
Ask your doctor. And also the truth is, like, you see these reports that come out and it's like top 10 most deadly cities because of pollution,
always,
right?
And Los Angeles is always number one, yeah.
It's always number one, right? And it's like, even like, I think bed bugs were up there too now. Like, did we learn that the other day?
Right.
Bed bugs.
Yeah.
Not as bad as Chicago, we learned, but
right.
But still. Can we pivot for a moment? I have been wanting to ask you about kids' skincare routines.
Yeah.
My daughter's turning 11, and it's interesting. When I was 10, I did not have a skincare routine. Okay, I'm going to be totally honest, right? I didn't have a skincare routine until I was like out of college. And I don't even know if it was real serious until I was 30. And it's still questionable today. But my daughter and her friends, they have that's a thing now, like their skincare routine.
It's too much.
It's too much. And I don't let her do the whole like go shop Sephora and whatever. But I did honor her this Christmas. And I said, okay, I did some research and I tried to get some like gentle for the skin things. And it's not a bad idea to wash your face, but I also worry about like them drying their skin out so young, right? Because, you don't need to have like a full routine. Can you talk about kids a little bit and what you recommend?
That's a great question.
Yeah. I mean, I think with TikTok and social media in general, it's blown up, the skincare routine. Mm-hmm. I feel old when teenagers bring in a bag full of things I've never heard of or seen.
You don't know the elephant cream?
Yeah, elephant cream where, a patient was using snail serum on their skin the other day and she came in with a horrible allergic reaction. Like
Oh no.
Wait a minute.
Snail?
What?
Snails, we're like, leave it in the garden.
There is snail. Well, I do salmon sperm.
And salmon, I have no idea what that is.
Yes, you do.
So.
You do. She does.
She does the salmon sperm. She does the salmon sperm.
I don't do it often, but I do the salmon sperm. I don't know, doctor. You say my skin looks good. Listen, it's salmon sperm DNA. I would never let my daughter use it.
I have no idea what that even means. Is it Korean? They're very big on their skincare.
Yes, but she's a doctor too. Okay. So she's not just a esthetician. She's a doctor.
Sure.
I probably do it like 3 times a year.
Oh, it's an in-office treatment?
Yeah, it's a facial and then there's tiny like surface injections. I don't do Botox, as you know. Because remember we were joking, my husband was like, no. And I was like, but he won't know, right, if I come in. I don't know. My husband's like anti-Botox.
He will know. He'll know.
I think what he's worried about, Dr. Ghasri, is that like I'd be the one person to get the crazy reaction.
You would. You absolutely would. You would.
Botox, I have not seen a bad reaction to it, honestly.
Yeah, I don't know. I do the salmon sperm. It's not like Botox where they're injecting into like the muscle. It's like a surface treatment.
And just makes your skin glow?
You get glowy afterwards. Yeah, it feels glowy.
Sure.
like you said, it's all about hydrating. You're penetrating. It's like having a deep facial or microabrasion where they're going to get in there and try to, hydrate underneath that first layer of skin. But But the kid thing, though, it's like, where's the balance, I guess, as a doctor? Because I want her to wash her face. Yeah. But I also saw when she was doing, like, someone as a Christmas gift gave her like masks or something, right? So all of a sudden she comes out, me and my husband are like, oh my gosh, she's got a red mark here. And I was like, oh, it's overdoing the skin routine.
Probably.
What's the balance for kids? Like, just wash your face? Do they need to moisturize? Or I
still think less is more. It depends what kind of skin they have. If they have, acne prone skin, wash your face and maybe a mild benzoyl peroxide cleanser, a salicylic acid cleanser, and a retinoid, a tretinoin can do wonders for the skin.
If you have acne.
If you have acne, and I think, in general, toner is overrated. Toner was used when the soaps weren't as effective, so you had to do toner to repair skin. So I don't think that's needed as much. I think the less steps, the better. Wash your face in a mild lotion, and if you're going to be outside, some sunscreen, and you'll be good. You'll be ahead of the game.
Fascinating about toner, because my mom swears about toner. That's like toner is her life.
I just think it's overrated. Yeah.
It's overrated now. It was literally because the soaps weren't doing their job.
Yeah.
That's so interesting. I know. It's so interesting.
I had no idea.
I think the toner companies are now going to find me, so. But sorry.
Okay, so I've got a quick question then. When a little kid has dry skin in the wintertime, should we just do something very gentle like a CeraVe type, moisturizer for the dry skin?
For sure. CeraVe, Cetaphil, Aquaphor is always a great one. The more the more you can goop on, the better, as much as they can allow you to.
Did you just say Cetaphil? Because Jenny yelled at me it was Cetaphil.
Oh, I don't know. Is it Cetaphil? Cetaphil?
I thought it was Cetaphil
also. Tomato. But maybe it is Cetaphil. I should know that, actually.
Potato.
Yeah. But any of these products are
gentler.
Gentle blend.
Well, because I even noticed when my daughter, she can get little pimples from overuse of products.
For sure.
Even. Right? She doesn't have yet an acne or anything, but like I did notice when I had to tell her, I was like, listen, sweetie, like I will get you something to wash your face, and I know this is fun, and they have their routine, and they put their little headband on, and they think that they're XYZ, but you don't want to mess your skin up at a young age either.
Yeah, just tell her less is more, for sure. But
less is more.
At the end of the day, it's not going to matter what you say; it's what her friends do. So let's be real. Let's be real here.
And on the flip side, with teenage boys, we can't get them to wash their faces or what, So it's you got
and also the boys are wearing their hair down a lot, so that's clogging their forehead. So we see a lot of acne on the forehead from that.
Yes.
From the swoop. The little swoop.
The swoop, I guess. Yeah, that's the new style.
Yeah.
The swoops in.
It's just called the mat down. It's just the mat down.
And then patients.
We call it the swoop.
They love beef tallow too lately. I think that's become like a hot.
What?
Beef tallow. It's like this moisturized.
Is that a food?
Is it beef?
No, it's like purified beef fat. Now they make it. If you look it up, they put it into lotions, and people are slathering it on their face.
How's that working out for them, doctor?
What?
I think they like one patient says her dog is licking her face a lot more now. So
I was gonna say, I bet that her dog is licking her face more.
The pets are loving it.
Wait, that's so funny because when Brian had cancer, I got really into like home natural skincare. So I was doing like avocado masks and things. And one of my good friends, Tess, was over, and we decided to do avocado masks. And my dog went nuts. Yeah, it was like went right for my face. It was just like lick.
Excuse me, I would have gone nuts for that too. Avocado, it's great. I would have gone for it too.
Just put some beef on it next time.
Guacamole.
It's like a meal. You're the different layers. You can have a meal. So you start with the avocado,
dip,
7-layer dip skincare. I love this. But is there something to the beef fat that's?
I think it's just super hydrating.
Right. Okay. Now I'm going to go out and try the beef fat. This is crazy.
Beef tallow.
Not me.
I had no idea.
I didn't either. I learned a lot of things I'd rather not learn from my patients sometimes, and that's one of them.
If you were to give us the top 5 tips, obviously we're dealing with the wildfires here, but in general, I mean, calamities can happen anywhere, right? Hurricanes, weather, extreme weather conditions affect your skin, What are the top 5 things that you would tell everybody simply to do and know to do to kind of prevent or deal with, their skin flaring up because of weather?
The main number one is just try to hydrate your skin, because the weather can be too dry for the skin usually. On the flip side, if the weather is too humid, try to wash off, shower right away. Yeah, use a salicylic acid wash. And then again, if it's humid, try to change your shirt right away, wash off right away.
And when you say hydrate, you also mean drink water, right? Do you see a difference in people who are conscious about drinking water in their skin?
I don't know how much it does for the skin. I think that's the excuse a lot of celebrities use for looking good. I saw a meme where, they say, they're all Botoxed up and filled up, and they're like, oh, it's because I drink a lot of water. So I think that's overplayed. But
here's my water. You're telling me my beautiful collagen is because of my water?
I mean, stay hydrated, sure, but I don't think that's gonna, make your skin glow per se.
What will make it glow?
Yes, give us the goods. Give us the goods.
We need all the tips.
I mean, I think most people are pretty in tune with healthy skin now. Just obviously, number one is always sunscreen. And then, I mentioned the vitamin C serum. There's retin A cream. Tretinoin is, that's been around since the 50s, 60s. So that's tried and true. That's a vitamin A cream that can kind of regulate the skin cell turnover. And it helps unblock the pores. And that's used for anti-aging all the time. A lot of patients ask for that. So those are the top 3 cornerstones, I would say.
Why haven't you given me that?
I know. Well, you never asked. I should. You
I
don't
think
need,
so
and you don't
too.
need it.
Wait, are there any free samples?
You
We
don't
need free
it.
samples.
Sure. We'll sample you up.
I think it's a really good point, though, that no matter where you live, it's probably the same, right? Protect your skin.
Exactly. Yeah.
If there's any kind of condition outside, maybe avoid it. There's nothing. And if you want to look as great as me, no, I'm telling you.
Go get your salmon sperm.
Get your salmon sperm. And I do salmon sperm DNA. It's not actual little spermies.
Okay.
It's the DNA, okay? All right, Dr. Ghasri, can we get your final thoughts about what we need to know about young people and their skincare?
So for all the teenagers out there, I know on TikTok you're seeing a lot of, various products and different trends, but I still think less is more. Just start with a mild cleanser in the morning like Cetaphil or CeraVe. If you have acne-prone skin, you could do a salicylic acid wash or a mild benzoyl peroxide wash. I wouldn't do more than 5% benzoyl peroxide. Then, apply sunscreen before you go to school. That's going to help your skin look healthy. And at night, just come wash your face with another mild salicylic or a gentle Cetaphil wash. And then you can, if you want to take the extra step as a teenager and prevent acne, you can put tretinoin cream or retin A cream on. Or Differin is over the counter now, so you can apply that and just go to bed with it.
Well, and now these kids are 10, 11. It's not even just teenagers anymore that are starting this the skincare routine. So it's I think it's an important thing to less is more is a really good.
Less is more for sure.
Yeah, because you want to watch what you put on your skin and you don't want to irritate it.
Yeah, and
because
just
that can cause
try to keep
problems
your
too.
hair off your skin, keep the oils off your skin. That will help too.
That totally makes sense.
Great advice for all those little ones.
Yeah.
Yes. I mean, let's talk about that toner myth because, my mom's been using that toner for like 55 years.
It's probably not a game changer for her. So, I think so. Toners these days are overrated. And I think if you were to leave one thing out of your skincare regimen, that would be the one to push away. Because nowadays, again, soaps are effective at clearing the skin and cleaning the pores, the face washes out there. And that's what toner used to help with, that getting that extra clearance, but no longer needed.
What was not in the soaps before that there is now?
That's maybe they didn't have good surfactants to clear the skin. I don't know the exact chemical, but they're more advanced now. They can penetrate a bit deeper and clear it out.
Is there anything, also like with natural skincare, because I'm a less is more person and I like to try to get organic or natural, but you can also, as we know, and Jenny always says, got to watch out for some essential oils because they can hurt the skin as well. Yeah. Do you have any recommendations if somebody wants to go a little more natural and not have so many chemicals in their skincare for their kid?
There's a great brand, Vanicream, out there. Vanicream, they have soaps, shampoos, conditioners, face washes, and that's very minimal chemicals, or actually no chemicals for patients with sensitive skin. So I recommend that for kids a lot.
And I do want to clarify, Vanicream is often considered a clean skincare product. It's not entirely all natural or organic, as we say, but it is void of, some of those harmful chemicals, parabens, dyes, fragrances, things that we worry about. Formaldehyde, which we can't even believe is in products.
Even though if things say the word organic, it doesn't mean it's healthy for your skin. If you think about it, poison ivy is organic. It lives in the wild.
Right.
But you're not going to put poison ivy on your skin.
Right.
So you can try to minimize the essential oils. And then the oils will even clog your skin even more and cause acne. So I think those are overhyped for the most part.
Great.
Stick to the basics.
It's what it always boils down to, the basics, right? Do that avocado beef mask, and you're going to be fine. The guacamole.
Bringing the taco chips over. Let's go.
That's about it.
Well, thank you so much, Dr. Ghasri. I really, really appreciate it. We always love talking to you.
My pleasure. Thanks for having me again.
I got to tell you guys, mind blown about the toner.
I thought the same thing. I had no clue about that.
My mom is literally always has toner when she comes here, and I always borrow it. And I haven't bought new toner lately. And I was just thinking the other day, like, oh, I need toner because of XYZ. I had no idea that like literally toner was birthed out of the fact that face wash was different back in the day.
Well, now you can spend that money on the vitamin C serum.
And just
shift your spending to something else.
I love a good vitamin C serum. Yeah. Oh my gosh. But I was like, really, toner is like not. That's crazy. Like, I mean, didn't you your whole life think that you needed toner?
Yes. We always thought we had to. We had these little makeup parties. Yeah. And we would have to, do like the whole skincare routine and then your toner. But then again, I would wonder about astringent. Is astringent bad for you? Because do you remember that was kind of a big deal back in the day?
That astringent was like a toner, right? Wasn't it? Or is it
kind
more
of like a more harsh toner, wasn't it? Like the blue, what was the blue stuff? Sea Breeze.
Toner. I thought Sea Breeze was like, I guess it was more of like a face wash meets a toner, like harsher.
And we would burn our skin off with it. We'd put it on.
I remember that was terrible in the 80s. Yeah. It was terrible.
Yeah.
Late 80s.
I thought it felt pretty good. I thought it felt good.
Very late 80s for me. Very late 80s. No.
Yes. Do you have a story to share about toner? Please go over to our website at www.ogross.com.
Make sure that you share it with friends, family, or anyone who could benefit from hearing these exciting insights. Be sure to follow us at It's Gross on social media.
And we are going to take a break next week, just a short break. Don't worry. We all get a little break sometimes, and be back up the following week for another fascinating and wonderfully insightful episode where you will learn things that you would not believe. Blow your mind, just like the toner. Blow your mind. So be back. So don't forget, even though we're taking a break, don't forget. You got lots of episodes you probably haven't listened to yet if you've just started following us. Go back. There's a lot of great content there. Take the week to catch up, and we will see you guys in 2 weeks.
Oh, gross. That drama's about to end, 'cause gross. Stop asking for a friend, taboos. Icky's what we do. Psoriasis, podiatrists, and pinworms too. It's so gross. No need for strife, because gross. Life is part of life, it's just science. Yeah, it's not so weird. We got the facts, nothing to fear. Oh, gross. It's just science, no, it's not weird. It's just science, nothing to fear. It's just science, so wipe those tears. It's boogers and a rash and that sticky scratch. Oh, gross. That drama's about to end, 'cause